I want to give you 4 exercises that you can do and add to your program confidently without the fear of doing more damage, causing a bigger herniation, or igniting some kind of crazy 2-week-long flare-up. So this is you. If you've been looking for the right exercises for your disc herniation or disc issue, you're in the right place. What is up, guys? William here from fitnessforbackpain.com, where I teach you how to overcome chronic back pain by mastering your mindset, improving your movements, and building strength. I'm super pumped for this series. We kicked it off talking about all things disc herniations, ruptures, and bulges. This whole series is on disc herniations. So that is you. You have a history of disc issues. Stay tuned. If you have not watched the first video, it's gonna pop up ding right here, which is gonna talk about the 3 rules you gotta follow if you do have a disc issue, right? Herniations, bulge, ruptures, whatever your situation may be, follow these 3 rules. That's the foundation. Now we're gonna move on to core training. I'm gonna talk a little bit about some do's and don'ts of core training with a disc herniation, but then we're gonna move on to some nitty gritty. Before we jump in, if you have not gotten it already, it's a great supplement to this entire series. If you have a disc issue, if you deal with chronic back pain, or if you have had some kind of fusion and you're trying to figure out how to navigate exercise for the long run. You want to use exercise smart, you want to do it safely, you don't want to be afraid to move, afraid to build strength. What in the world should you do? Well, I have a free workshop. If you go to www.fitnessforbackpain.com/backpain workshop, you can get it there, download it, watch it. It is yours to follow along with while we go over all the key things in this series. Without further ado, let's jump in. All right, some quick do's and don'ts of core training with disc herniation, disc bulge, disc rupture, anything that has to do with a disc injury. And there's a few things I want to go over really quick before I show you the 4 exercises that I want you to be doing. One is you want to look at training your core first. Before your training program actually starts, before you're doing your big lifts, always look at core training first. Second thing is we're going to take away twisting, flexion, and extension from your core training program. I want you to focus on stability in the lower back, stability in the trunk, and keep it there, right? These core exercises that you're going to be doing today are going to be focusing on a neutral spine, building strength in a neutral position so that we can kind of work towards getting relief from this pain and keep exercise from creating bigger issues, creating a bigger herniations, bigger bulges in our lower backs, okay? So with that being said, let's jump into these exercises. All right, so the first exercise I'm gonna be doing is one of my newest favorite core exercises that is safe for disc herniations, ruptures, bulges, even like fusions, right? It's a great neutral position exercise. I'm not sure what the name of it is. Got a good name for it? In the description of this video, let me know what you think it should be named. I'm gonna call it Palef Press to Warrior Press. That just makes sense to me. So what you're gonna do, get onto one knee. If you wanna use the leg up that's closest to your band, that's fine. A little bit less stable but more challenging is if the opposite leg is up. So pick one that fits best for you. Obviously go off of how you feel and then move on from there. Get your lightest band that you have, attach it to your rig or whatever you have available to you. And we're gonna go into just the traditional Palef press, which if you know that, it's just this, right? We're gonna combine this Palef press with a warrior press, which is this. Okay, so before you take off, get your pelvis in a good neutral position where it feels comfortable. Your ribs are gonna come down and get set. Once you're there, this is what it looks like. We're gonna press out, fully stretched out, and then go all the way to the top. Back down and in. I will say having your arms fully stretched out can be kind of challenging. So what you can do if that's too intense for you, go halfway with your arms, elbows still bent, and back, just like that. All right, so the second exercise is what I like to call ski pulls. Again, we're challenging that neutral position, making sure that we're not in overextension, not trying to flex or twist. We're trying to keep it neutral, trying to build structure and stability and safety around the spine, especially if you have had some kind of disc issue or you're navigating exercise with a disc herniation, bulge, rupture, whatever you may have. Now, what you're gonna do, have the same light band attached to your rig or whatever you have. I'm gonna step out and I'm gonna get into this ski position, right? I'm slightly in a hip hinge, weights back. And what I'm gonna do is I'm gonna grab the band behind me, right? So there's tension. As soon as I start pulling, there's tension. Once I'm in a good position, I'm gonna pull my arm forward, right? The further I come out this way, the more my stomach is gonna contract and brace. What I wanna do, if I wasn't bracing myself, is as I pull, this is twisting me this way, right? If I had no core at all, as I'm pulling, I'm gonna twist this way. So you're keeping yourself from doing that, building stability here, and it's safe for those lumbar discs. Now, so what it looks like is I'm gonna get set, arms back, ready to pull, get in a good neutral position, quick brace, very light brace, and I'm gonna pull the band forward while keeping that same position and back. So pull forward and back. And you'll wanna do obviously both sides. Get set in that hinge position. I'm gonna pull out and back. This is a safe exercise because you're not challenging flexion, challenging extension in a sense of like trying to do something like this or getting into an overextended position trying to complete an exercise. No, you're getting yourself in your comfortable position and then you're creating that challenge without having to move that trunk. So it's anti-rotation, anti-extension, and anti-flexion. You're trying to keep yourself in that comfortable neutral position. All right, so the third exercise I'm gonna show you is the traditional side plank. Now I picked the side plank over the traditional plank because a lot of times when it comes to the normal plank, a lot of people get into too much extension in the lower back. So if you've had a disc herniation, rupture, bulge, or if you've had any kind of surgery on your lower back, that can be kind of sensitive. So I chose the side plank to help build that oblique strength, just that stability on the side here without having to put the lower back in any kind of weird position, especially if you've had some kind of disc issue. So side plank traditional, you can always start on your knees. This is a great starting point, making sure you're not too slouched like this. If you want to get into a position safely, is you're going to sit back, so get ready like this, and then come forward with the hips. Instead of slouching like this and then going into it, you'll sit back, get set, sit back, then sit into it. So ribs are down, good comfortable position. This is the knee version of this. Now, to make it a little bit harder, outstretch your legs here. Find a position whether you like it to be here or here, depending on how you like it. I personally prefer, I can do both ways, but the top leg I like to be out. It just puts my hip in a better comfortable position, right? I'm able to kind of adjust forward and back a little bit easier with that front leg forward. If you don't like that way, find a way that you like. Now, so the full side plank, same idea. I'm gonna sit back, get ready, and I'm gonna come forward into this plank here, and I'm just gonna hold. Okay, if this is too much for you, you can always put an arm down or bring that top leg in, and now you're taking a lot of load off of the body by having this leg here. All right, so the fourth and final core exercise that I love for anyone who has any kind of disc issues is the loaded dead bug. If being on the floor is too much for you, you can add some pads. You can even do this on a firm bed if you gotta start kind of in a very more of a sensitive situation. What I do is I'll take a dumbbell, grab whatever weight you feel comfortable with that you can manage. Again, it's not about going super, super heavy and making it super, super hard. You wanna have control over the position of your lower back and the rest of your body. So getting in a position here, what I'll do is I will get comfortable in my hips. So I'll rock back and forth, find that neutral, ribs down, quick breath out. I'm gonna pull my dumbbell up over my head, and I'm actually gonna come out over my head. What this is gonna do, it's gonna challenge keeping that rib down. So as this weight goes out, I wanna flare, go into extension, which is a bad position for that lower back, especially with disc issues. So I wanna keep that rib down, and then I wanna challenge that strength with that dumbbell coming out. And then I'm gonna add the dead bug leg movements. So what that looks like, grab your dumbbell or kettlebell, whatever you have. I'm gonna bring my ribs down.
What you're gonna do is just focus on dropping one leg at a time while trying to maintain that neutral structure in your trunk. So you'll see my left leg come down. It's gonna come back up and come down with the right leg. And you're just gonna repeat this for the amount of reps that you're doing, making sure that you're breathing, but your brace is on point.
To me, what makes the exercise is having that dumbbell over your head. Without that, you're gonna see a difference. If you wanna try it without it, then try it with it and see which one you like better, try that. But for me, having that dumbbell is super essential to make this exercise kind of come together. And that is it. 4 of my favorite core exercises for people who've had any kind of disc herniation, rupture, bulge, history in your life, you're trying to navigate it. Try those 4 core exercises out and let me know in the comment section which one is your favorite, one. I'm very curious because I think a lot of people have different experiences with different types of core exercises. My favorite one, to be honest with you, is the paylift press to warrior press. Again, I'm still looking for a name, or if you know the name of it, let me know in the comment section. But that's probably my number one exercise. So if any of those 4 that you like, start adding it to your program. Thanks again so much for watching, tuning in, liking, sharing, subscribing, and hitting that bell notification. I really appreciate it. Anything I can do to help you, let me know in the comment section below. Love talking to you guys. And that's it. See you on the next episode.